as the pandemic spreads further and health systems are put under further strain, what should people be doing to access the care they need for other issues that are totally unrelated to COVID-19?
It's a real concern because hospitals and health systems right now, as they should be, are very focused on preparedness for a potential influx of patients, as well as for those patients that are already in the health system. But that doesn't mean that all of a sudden you aren't going to have issues with diabetes, that you aren't going to have issues with heart disease or cancer treatment. I think right now, though, the focus is still, as it should be, focusing on coronavirus and COVID-19 and having preparedness and really recognizing what's the difference between something that might be an elective surgery or an elective issue versus something that's required. There's still going to be car crashes. There's still going to be emergencies where people need to have surgery. They need to have a blood vessel open. They're still going to have stroke. So we still need to manage those conditions, and the health system is still prepared to address those. But some other things that we might typically have gone to the doctor about might have to wait. That doesn't mean that they're going to have to wait for months, but we can do a lot more by telemedicine, and there's been a loosening of the typical restrictions. So you might not need to go in because you have a rash on your forearm. You can do that by telehealth. And there's a lot more that we can do there and utilize that. And that's where I think we're going to see a lot of progress, because there's more discretion about using FaceTime and some other platforms that typically aren't allowed. You don't have to, as a physician, be licensed in the same state right now as the person that you're seeing. So I think we need to shift more right now to telehealth and telemedicine and use some other strategies than physically going to the doctor's office, the dentist's office, the optometrist and ophthalmologist, while at the same time recognizing when there's a true emergency, you still need to get to the hospital and to the ER.
It seems like with digital transformation, we certainly are more prepared to handle some of the outlying issues than we would have been even just a handful of years ago.
But still, it's interesting how patients are going to respond, because a lot of folks have not used telehealth and telemedicine.
Right.
So for some folks, it's new, and using it on Friday of last week, sometimes you leave the call and think, was the patient satisfied? But what I've learned? We always say it's about history taking. And what I find is that patients get to talk more during those visits. We're not as much in a rush and interrupting. And,
Right.
and you have to be much better about, interviewing the patient and learning their story. But it's still new concept for some folks that, hey, I'm going to do this all by, video conferencing or phone. But we'll see. It's, it really shows how we're trying to be innovative during this. And as you point out, which is an important point, we still have other health issues during the time of this epidemic, this pandemic, and we need to figure out the strategies of how to adequately address those as well. Because what we saw with H1N1 to some degree is that there were other reasons why people had health problems. Not that they died of H1N1, but they weren't able to refill their medicines. They weren't able to go to the doctor when they actually had a true emergency. Let's remember about the social determinants of health that have a big impact, that are outside of the healthcare system. So it's really going to take some careful attention to the 360-degree aspect of health, while at the same time recognizing right now we have some priorities.
Well, it's going to be an evolution for both people and doctors as the bedside manner becomes somewhat of the FaceTime manner, which is very important. But you mentioned some of the social elements of this, and human beings are deeply social creatures. Several recent studies have showed that one of the most significant predictors in the length of human life was having a strong network of family or friends. Mm-hmm. How concerned are you about the long-term negative side effects of social distancing on people's health?
Yeah. Well, we're not saying social isolation, which is really
Right.
different than social distancing. But I think it is a real concern, and we need to think, how do we provide mental health services? How do we provide, other benefits to people who are struggling, particularly the elderly? There's lots of issues with loneliness in this country, and we know that can be an independent predictor of early mortality. So, how do we utilize the different platforms that we have in terms of um, such as you and I are talking today, and how do we continue to have some type of communication? I have very young children, I mentioned earlier, and some of them are using a platform to check in every day. They're posting videos, so it's not exactly the same as we're used to. Um, but it's still some ways trying to maintain connection, and that's what it's about. And we'll see where we are, in a few more weeks in this epidemic. But we really want to make that effort to remain connected to folks.
Well, as we're remaining connected, are there steps that people should be taking to promote their good mental health, their good physical health in this time when they are distant physically from
Yeah.
other people?
It's always about trying to eat healthy, which can be difficult when we're stressed. It is about trying to
Mhm.
maintain some type of physical activity. Most gyms are closed right now, but that doesn't mean that you can't be physically active, where you live, to go on walks, while maintaining social distance. I mentioned a little earlier, we should take a break from social media in terms of the news, in terms of what's going on. You don't need to be updated every hour. Taking some time to decompress, perhaps watching a movie, reading a book, and then trying to maintain connection with loved ones and friends. And that can be challenging during this time, but making those efforts. So it's still about your overall health as well.
Well, Dr. Whyte, this has been just a fantastic conversation. I'm so grateful for the opportunity to talk with you. It's been reassuring for me, and I know it will be reassuring for our viewers and our listeners. Uh, as we wrap up, I'd like to ask just one more question, and that is, what would you say to Americans and people around the world who are scared right now about the pandemic?
It is normal to have a lot of anxiety about what's going on right now. But it is important, as we talked earlier, about knowing your risk, about becoming educated and aware about what you need to do, and really taking it day by day. Um, I don't know where we're going to be 2 weeks from now, 4 weeks from now, but I can control much of today and what I can do today. I can listen to the experts and focus on what they're telling that we need to do. And then, working with loved ones, thinking about your community, and making sure that you're trying to preserve your own health and keep everyone else healthy in your community. And there's, it's normal to be anxious, but we want folks not to become panicked, because when you start to panic, that really leads to inaction. And now, again, it's about controlling what you can control, becoming educated in what those safeguards you need to do, and then trying to do as best as you can on a daily basis. That's all we can ask people to do.
That's a very hopeful, inspiring, and empowering message. Dr. Whyte, thank you so much for your time today. It's been just very informative.
Well, thanks for the opportunity to talk.